Okay, well, welcome. We are so excited to have you all here. Today we are on the Human Body Master Guide meeting with Dr. Ray Andrew, and Dr. Ray Andrew is an MD and a functional medicine doctor and just loves teaching. He is just, I don't know how many hours he puts into all his presentations, and you're going to realize that, but he loves to educate everyone on how the body's working, which is why we love him so much. Because he wants you to have those tools in your toolbox. And that's what you're going to learn today. So leaky gut, right? We've talked a lot about leaky gut in the past, but Dr. Andrew takes it a whole another such notch. He's going to give you so much information on things that you can be doing at home and things that you might look for in determining, are you dealing with IBS? Are you dealing with a leaky gut? Or are you dealing with SIBO or an IMO? And so this is going to be a lot of fun. So Dr. Andrew, thank you for joining us. We're excited to learn from you again today.
Thank you for having me.
Well, we are so glad. Okay, so you get to take it away. It's your show now.
Okay. Sitting across from a patient in the exam room one day, I was told, if you could cut this foot off, I would be fine. The pain never lets up. It's not uncommon for me to encounter patients who wish they could make one or more body parts disappear to solve their problems. But do you ever wish you could just cut off your belly? Did you know that an unhealthy gut is also the source of a vast array of diseases elsewhere in the body? This was recognized nearly 2,500 years ago. This is the Hippocrates, the father of modern medicine, taught that all diseases begin in the gut. Growing up, I thought of the gut as nothing more than a long tube. I put food in one end and poop came out the other. But it turns out that the gut is far more complex than this. It's responsible for digestion, absorption, elimination, immune protection, blockage and removal of toxins, vitamin production, and more. The gut actually starts at the lips and ends at the tailpipe that we call the anus. Suppose your gut isn't happy. You may have discomfort with eating, diarrhea, heartburn, belly pain, or any other number of symptoms. How can we find out what's going on? We can do a scope from above or below, a CAT scan, ultrasound. It turns out that these tests are really good for cancer, ulcers, and other big things. But the overwhelming majority of symptoms people experience are caused by things too small to see. Unless there are certain warning signs, these tests are actually the last things we do. I love it when patients come to me and they say, I've been to the gastroenterologist and I complained of X, Y, or Z, and I got an EGD or a colonoscopy, and I say, wait, don't tell me. It came back normal. Yeah, how'd you know? Because colonoscopy and EGD aren't going to show the causes of that particular symptom, because that's, again, it's really good for cancer, but not so good for functional problems that are microscopically induced. So instead, we take a thorough history and then order tests that tell us what's happening on the microscopic level. For example, comprehensive stool analysis. I love it when a patient tells me, oh yeah, I've already done a poop test. And I say, and wait, don't tell me, it came back normal, right? Yeah, they said everything was normal. And you still had your problem, right? Yeah, that's because the stool tests that they do, the routine hospital stool testing, only tests for the big things like Salmonella, Shigella, C. diff, and Giardia. These problems, unfortunately, or fortunately, I suppose, cause a fraction of people's symptoms. And so that's why they're always, or I should say almost always, come back normal. Another test we run is intestinal permeability testing. This looks at a number of antibodies related to the gut lining that tell us if you have leaky gut. Food sensitivity testing. There are all kinds of food sensitivity tests that I've run and seen over the years, but I'm going to show you the one that I currently use that is a lot more sensitive and specific to what we need to find out. Typically, when somebody goes to an allergist who is supposed to be the expert in allergies, they will run an IgE test, either a blood test or on the arm or the back, and surprisingly, most of them will come back normal, and that's because they're only testing IgE allergies. Those are the rapid allergies, like we see when you eat shrimp and suddenly your throat swells up. But the majority of people do not have these immediate type hypersensitivity reactions, which are identified using IgE testing. And so of course, those are going to come back normal. So what we're talking about are delayed type hypersensitivity reactions that you may or may not even recognize in terms of symptoms, or the symptoms that are occurring are not something that you would have thought was related to foods or other substances. But in all cases, whether or not you have symptoms, they are causing damage, inflammation behind the scenes. So here's an example of stool testing that we do. You can see the first group here are pathogens that are commonly tested for using the routine hospital testing like C. diff and E. coli and Shigella, Salmonella, cholera. Then we get some parasites, Entamoeba, Giardia, that's a familiar one. And then we actually get some viruses in here. H. pylori is standard on every test we run. And we actually find it a lot more commonly than we think. H. pylori is the particular bacterium that was identified back when I was in medical school to cause ulcers. But the majority of people with H. pylori don't have ulcers, but they do have other symptoms, and they're ignored because it's not tested for, unless you have an ulcer. Then we look at normal bacterial flora. These are the good guys that you're supposed to have in your intestines. And then we look for the not so good guys, the opportunists. Now, these guys aren't necessarily going to kill you, but they're not helping you, and they do cause a lot of dysfunction. Now, there's a subset of these opportunists called potential autoimmune triggers that have been identified in studies to be associated with specific autoimmune diseases like lupus and rheumatoid arthritis. Then we come to yeast. The most commonly recognized yeast are Candida, different species of Candida, particularly Candida albicans. And there are some others in here that we test for, and these cause all kinds of dysfunction, not just in your gut, but throughout your body. Then we get to parasites. A lot of these, interestingly, again, are never tested for in routine testing. And if you look them up on the internet, you'll find that a lot of times, a lot of places consider them to be normal. They completely ignore them. But when you're having diarrhea or constipation or autoimmune disease or other problems, they're not so normal. So we want to get rid of them. Then we check for some worms. I don't very often find them, but I do once in a while. Then you can see this elastase 1. Well, steatocrit, this is a marker for malabsorption of fats. So when that's high, you're not absorbing fats well. And some people say, oh, that's great, I don't want to absorb fats. But you do want to absorb fats because your brain is made of fat, and and hormones require fats. So yes, you definitely want to absorb fats. It's if you wanted not to absorb something, you'd rather not absorb sugar. Elastase 1. This is a marker for digestive enzyme production in the pancreas. We definitely want to make sure we are making enough digestive enzymes. And their bare minimum is 200, but actually healthy is over 500. So this is extremely common. We find maldigestion, which is therefore followed by malabsorption. What's the difference? Digestion means breaking down of nutrients, macronutrients, meaning fats, carbohydrates, and proteins into fatty acids, simple carbohydrates, and amino acids. Without without breaking those down adequately, then we cannot absorb them in the small intestinal lining, which I'll show you shortly. If we don't break those down, then of course we don't absorb them, and we can't, they can't do the whole reason that we ate them in the first place, to get energy and micronutrients to perform numerous functions in the body, will not happen. But something else very interesting happens, and that is if we're not feeding ourselves due to this maldigestion, malabsorption, guess what we're feeding? We're feeding the unhealthy microorganisms. So that's these guys right here, the opportunists. If we don't feed ourselves, we're feeding them, and they cause other little troubles that we don't like. Okay, so coming down here, one of those troubles is beta-glucuronidase. This is an enzyme that's made by those opportunistic bacteria that causes recirculation of toxins. So when we detoxify toxins and hormones that we no longer need in our liver, then they are released into the gallbladder and into bile, and then into the small intestine, and then we want to poop them out. But beta-glucuronidase retoxifies toxins that we have detoxified, and so they're recirculating. And after you go through all the effort, which is an intensely energy dependent process in the liver uses a lot of energy to get rid of our toxins, and now we're reabsorbing them, which increases our risk of all kinds of things, interestingly, including colon cancer and breast cancer. So that's a whole nother presentation we could have, but you don't want to have too much beta-glucuronidase. This next one here tells us about blood, undetected blood in our stool. That's kind of important for inflammatory bowel disease and cancer and ulcers. Then we come to secretory IgA. This is a marker for the health of our immune system in our gut. If it's too high, then it tells us you're fighting something, whether it's an infection or commonly a sensitivity or an allergy. Then we have, and if it's too low, then our gut immune system is weak, and we can't fight the things that are coming down in that we swallow or drink. Then we have anti-gliadin. We want this one to be less than 20. They say 157, but if it's over 20, you're reacting to gluten. So that is one marker of gluten sensitivity. And on the bottom, you can't see it, but it's calprotectin. Is a marker for inflammation in the intestines, released by white blood cells in the intestines. So we don't want that to be too high, because that would signal that we're either fighting a microorganism, or we have ulcerative colitis or Crohn's disease or a cancer. Okay, moving on to intestinal permeability. Here are a bunch of antibodies. that are all related to what I'm going to show you shortly, the depiction of the small intestinal lining. So when these guys are high, they are telling us that your small intestinal lining is damaged and your immune system is reacting. That is not a good thing. So this tells us if you have leaky gut. And we can see in this case, this is this patient's previous results from the year before. Was it a year before? I can't remember. Where they had anti-lipopolysaccharide, demonstrating that lipopolysaccharide, a toxin released from bacteria in the intestines, was getting into the bloodstream. Not a good thing. And then you can see here on the current test, their anti-lipopolysaccharide antibodies have normalized. So their leaky gut has healed.
That's awesome.
So here's the next test that I mentioned. This is a food sensitivity test. Now what we like about this one is it's not just IgG, which is what most food sensitivity tests are, the ones that I used to run. It's also IgM, IgA, and then the type 3 and type 4 T cell mediated. So all delayed hypersensitivity foods it will test for. But it's not only more sensitive, but also more specific than the other tests. I used to get back, when I did IgG testing, I used to get back on a number of patients, it would come up with, like 50 foods out of 88 tested that were positive, and then, the patient only had like 30 something foods that they could eat. And basically, they were having spinach, celery, and water for breakfast, lunch, and dinner. I'm exaggerating a little bit, but you get the idea. You don't want to identify that many sensitivities when it turns out you're really not sensitive to all of those. So this particular test is using lymphocytes to actually determine which foods are causing reactions in real live time. And as a result, we get back reports like this: strong and moderate reactions. They don't give us all the mild reactions that aren't going to be that significant. And so typically we'll get a handful, sometimes 1, sometimes 5 strong reactions, and then a larger number of moderate reactions. But these, again, maybe 3 to 5, 3 to 8 at the most is what I tend to see. And that's a lot more manageable. They're still significant because, if you can't have potatoes or spinach or whey, that eliminates a lot of things and from your diet. You'll notice also here, of course, dairy, that eliminates a lot for a lot of people who aren't used to going dairy-free. You'll notice it also tests for things like dyes and some toxins. PVC is a common one we see. We commonly see a variety of dyes, and those are found in a lot of processed foods, in cosmetics, shampoo, in clothing. So it makes you aware of the fact that you are reacting to those when they're in your foods. And a lot of people don't recognize that dyes are used not just in foods, but in drugs, of all things, because you got to make the drugs look pretty or else you won't swallow them, right? Same with over-the-counter drugs have dyes. And guess what? Even if you're not sensitive to those dyes, you want to take it easy on processed foods and on drugs anyway for a variety of reasons, but also for the fact that those dyes are known toxins to the to cells, and you want to avoid, we have enough toxins that we cannot avoid. You want to avoid every toxin you can get.
So Dr. Andrew, if
Yeah.
I can ask, so obviously the people who are close or can fly in to see you are gonna be able to do this. Is this like, was the stool test a GI test? Was it the GI mapping test? And I mean, are there names to these tests? So if they can't come see you, they know what they can be asking for in their areas?
They can, that is the GI map.
Okay.
The difficulty of it is finding a doctor who will order the correct test.
Okay.
And sometimes we actually have people who can't fly in, and we will send them the test kits.
Okay.
And then when they're blood tests, then we have to have whoever draws their blood, they have to be agreeable to using our test and not theirs.
Mhm.
And they have to also call our office to make sure they know how to do it right, because if you don't draw it correctly, process it correctly, ship it correctly, then you'll have wasted your time and money and blood.
What kind of food testing is this? Is this done by blood?
This is ELISA.
Awesome.
And so we have a test kit that we draw the blood with and send it back to the company.
Okay.
So
They can come.
then we get a list of all of the non-reactive items. And we see again here, this tells us which foods an individual is not reacting to, but it also tells us which toxins they're not reacting to, like, for example, 2,4,5-T and this 1,2-dichlorobenzene. So we see, and I explain to people that this is not, that the ELISA testing is not it is not identifying, it's not calling the good guys versus the bad guys. It's calling the guys that your immune system is reacting to and not reacting to. So we still want to avoid these toxins because they damage cells and they impair mitochondria production of energy, but they aren't causing reactions in the immune system. Later you get a booklet actually that tells you, that has all these reports in it. And later in the booklet, it explains in more detail what the reactive foods are. And what I really like about it is sources of exposure. And so it tells you, you find this in this kind of food or that kind of food, or in textiles, or in water supply, or in cosmetics, or in medications. And then it gives you alternatives that you could use to substitute in its place.
That's awesome.
It is awesome.
How much does that kind of test run, Ray, if we were to come out?
It depends on how many foods you want to test.
Okay.
So we typically test for, I believe it's 80 something, and that test runs $275.
Okay.
And you can test all the way up to like some 600 and something, where it gets into specialty things, herbs and more dyes and more toxins and ethnic foods, and you're getting up into the hundreds and $1,000 range.
Mm-hmm. Awesome.
So however many items you want to test, you just indicate based on how much money you want to pay. Okay, so one of the most common gut problems we see by far, I know you talked about SIBO, correct?
Yep.
Um,
And IMO.
and IMO. So there are a lot of different things that can go wrong in the gut. But one of the most common that we see is leaky gut, which the medical term for it is intestinal permeability or intestinal hyperpermeability or enhanced intestinal permeability. And I'll tell you something very interesting about this. Well, let me tell you that after I explain.
Keep us in the suspense.
Keep you in the suspense.
Dr. Andrew.
So this is a depiction of the cells that line these small intestines. And these cells are, we like to, as I mentioned earlier, I used to think of this as a long tube, but it's not exactly a tube because it has gaps, or I should say it can have gaps, and it's comprised of a bunch of individual cells that are attached to each other with these little bungee cords that I call them, and these are called tight junctions. Now, when these bungee cords get damaged, then the tight junctions are no longer tight. And when they're no longer tight, then things can get in here that shouldn't get in here because we have the bloodstream right here and we want to protect the bloodstream at all costs. Because technically on this side, and if we look in here, can you see my cursor moving around?
Yep.
Okay. In here, inside the gut, this is technically considered outside the body. And so this lining here, the tube, is actually designed to keep out things that don't belong inside the body, which means inside the bloodstream. So we have this lining of the small intestinal lining is designed to allow things to get in that are supposed to get in, which we call nutrients, and water, and to keep out the things that aren't supposed to get in, which we call microorganisms and toxins and undigested food particles. So I mentioned earlier, we can only absorb the simple carbohydrates, the amino acids, and fatty acids. So they have to be broken down first. Now, if we get an undigested food particle down here and it gets down to the basement membrane, then it's going to meet some immune cells, white blood cells, and antibodies that say you don't belong here. And so they will attack it. Now, this is not a living substance, so it doesn't care if it's attacked, but we care because it creates antibodies. And those antibodies, through a process called molecular mimicry, actually start to recognize not only that undigested food particle, but also proteins and other components of our own cells. And then we develop autoimmune disease. But there's other things that get down here that we don't want down here, like bacteria, parasites, worms, yeast, and viruses. And so we want to keep this these tight junctions in good shape at all times to prevent these things from getting into the body. So what causes the tight junctions to be damaged? Well, toxins is a very big one. So that's why I made mention earlier of dyes. You know, when I was a kid, I used to think that it was really cute to suck on a popsicle because it would turn my tongue blue or pink or red. But you don't ever want something to turn your tongue colors, because the reason it's turning your tongue colors is because it is breaking double bonds in the cell membranes of your tongue. If it's breaking double bonds to change your tongue colors, guess what it's doing to your small intestinal lining? It's breaking the tight junctions. So that's a no-no. It's hard to explain that to our kids because it tastes so good and it looks cool, but it's a bad thing. Stress damages the intestinal lining. Emotional trauma, systemic diseases of all kinds, infections, not enough stomach acid. So guess what we're doing? We are taking drugs called omeprazole and Nexium and pantoprazole and others to block stomach acid because of our heartburn. That's a big bad no-no. We should instead figure out what is causing the heartburn and fix it, rather than perpetually taking a drug to lower our stomach acid, because God gave us stomach acid for a lot of reasons. But when we don't have enough stomach acid, that contributes to breaking down of the intestinal lining. Ibuprofen, even one dose, damages the intestinal lining. Antibiotics, another big cause. Dysbiosis, that's when we have too many bad bacteria and not enough good bacteria or other organisms. Alcohol is another deal breaker. I know that there's evidence that that quote unquote moderate alcohol reduces heart disease, but take your pick. It has other consequences such as cancer. Any dose of alcohol increases risk of cancer and intestinal permeability. Okay, so what else? So let's talk about a few toxins. Glyphosate, what's that?
Roundup.
Roundup, yes. Leaky gut was practically unheard of until glyphosate came along. Glyphosate pokes holes in the intestinal lining like nothing else. Other pesticides do as well. Food coloring, I've talked about that. Artificial sweeteners. One of the things that happens with toxins is that they attach to foods. And when the foods get down in the small intestines, they cannot be digested because the enzymes can't attach to them because they have toxins attached to them. So that food particle toxin complex gets down to the basement membrane and finds immune cells and then triggers autoimmune disease. It triggers the formation of antibodies. So all of these toxins we want to avoid as much as possible. Processed foods are loaded with additives, preservatives. Heavy metals are in our food supply, in our water supply, well, they're all around us. And then, of course, we put them in our mouths anyway when we crimp sinkers, lead sinkers, or when we touch them in our hands when we're reloading bullets, for any of those who are gun enthusiasts. So it's a big deal. Plastics, air pollutants. Okay, glyphosate in particular. We like to wash our fruits and vegetables, which is a good thing. The only problem is that glyphosate is incorporated into each cell of the plant, so you can't wash it out. And it accumulates in animal tissues, so that's a big unrecognized problem with our meat supply. Is when they're not free range meat, animals, then when there are these CAFO animals, then they are loading up with glyphosate. So eat organic as much as possible. You can help remove glyphosate with activated charcoal. A lot of people use that on a regular basis. Okay, NSAIDs. What are NSAIDs? Ibuprofen, also known as Advil, Motrin, naproxen, Aleve, Celebrex, indomethacin. All of the NSAIDs increase intestinal permeability within 24 hours, whether short-term or long-term. So how does leaky gut affect you? I've already talked about autoimmune disease, but causes gas, bloating, cramps, diarrhea, constipation. How common is this? Can I just say that nearly everyone who walks into my office has one or more of them?
Yep.
Infections, respiratory problems, allergies, eczema, psoriasis, which is an autoimmune disease, all kinds of rashes, acne, arthritis, fibromyalgia. Something interesting to point out here, skin problems. Anybody comes in with skin problems, they've got a problem with their gut. The gut is not healthy. Skin is the window into the gut. And of course, who would think your food and your gut has anything to do with arthritis and fibromyalgia? Of course, Karen would, and all of you guys would, but in the general public, we think of arthritis, well, oh, that's because you've used your joints, you've overused your joints. Are you kidding me? People have been alive overusing their joints for thousands of years on this planet. In fact, they use them a lot more than we do. And they didn't have arthritis like we do now. And fibromyalgia was unheard of until modern society with all of its toxicities and infections.
Mm-hmm.
Okay, so if that's not bad enough, add to that fatigue. This is the #1 problem I hear in the office. #1, far and away, fatigue. And it has lots of causes. And gut is a big one. Hormone imbalances. Imagine that, your gut dysfunction causing hormone imbalances. Yeah, that's a big deal. Sinus problems, allergies, difficulty losing weight. So you can eat spinach all day and still can't lose weight because of leaky gut.
Mm-hmm.
So autoimmune disease, heart attacks, heart failure, cancer, asthma, high blood pressure. This is always funny because in traditional medicine, we think of high blood pressure as being caused by a deficiency of high blood pressure drugs, right? How about we work on leaky gut and inflammation, hypothyroidism, brain inflammation, elevated cholesterol. Wait a minute, I thought high cholesterol was caused by a lack of cholesterol drugs. Or I often hear, oh, it's because my dad had high cholesterol, my grandpa had high cholesterol. Well, maybe your dad and your grandpa ate the same trash that you eat. Who knows? Colitis, meaning like ulcerative colitis and Crohn's colitis. Irritable bowel syndrome, I hear that all the time. Oh, I have irritable bowel syndrome. Really? Maybe you just have gut dysfunction and the doctor who diagnosed you with irritable bowel syndrome just didn't know what was causing it. But really, irritable bowel syndrome isn't a disease. It's just because they haven't fixed the underlying cause. Okay, so let's see. I also wanted to point out here that what is happening, this same process that's happening in the lining of the small intestines is also happening in the blood vessels of the heart and the brain. So whenever somebody says you have leaky gut, what they also mean is you have leaky heart and you have leaky brain. So if you want to see what's going on in the heart, think of your cholesterol. Now, we all need cholesterol. We live on cholesterol. We die without cholesterol. In fact, we don't even exist without cholesterol. But when we have small LDL particles, they can get in these little gaps here between the endothelial cells of the blood vessels in the heart. They get down here and they get under here, and then they form what we call plaques right in here. So that's leaky heart. And in the brain, toxins get into the brain. They're supposed to be blocked, but they cause damage to nerve cells, neurons, and contribute to dementia and other such things. So what I wanted to convey to you is that when people have diarrhea, bloating, belching, gas, heartburn, other such problems, they often think, oh, this is a nuisance. Let me take this drug that makes that nuisance go away. But that nuisance is actually telling you that you're on your way to heart disease or dementia and other such things. Okay, so I mentioned autoimmune disease. Here are a few of the many autoimmune diseases. Hashimoto's, that's the #1 far and away most common autoimmune disease I see. Celiac disease, ulcerative colitis, Crohn's, type 1 diabetes is an autoimmune disease. Rheumatoid arthritis is the one people most commonly recognize. Lupus, psoriasis, MS, and many more. I mentioned brain dysfunction. Leaky brain causes attention deficit, behavior problems, mood swings, depression, obsessive compulsive disorder, anxiety, dementia, Parkinson's, autism, and migraines. So when someone has ADD, we should be looking at their gut, among other things that we look at, not just throwing an amphetamine drug at them. And when they have behavior problems, we shouldn't just be putting them in timeout. Yes, they could be misbehaving, but they could also have gut dysfunction because of the popsicles they're sucking on and the other trash that they're eating. Do you have an antidepressant deficiency? Well, maybe not. Maybe you actually have leaky gut. And you may or may not have a sumatriptan deficiency. You may just have leaky gut causing your migraines. Okay, so let's see. Poor diet, chronic stress, toxins, all kinds of things caused by leaky gut. So there are a number of things that have been used, and you can Google leaky gut and find all kinds of things. Remove some inflammatory foods, get rid of toxins, reduce your stress, take some L-glutamine, some licorice root and quercetin and other things. Do bone broth, that's a very commonly recommended thing. Fermented vegetables. The problem is that a lot of these things that we do aren't getting to where they need to go. And the reason that they aren't being effectively utilized by the body when we're doing our homebrew leaky gut protocols is because they're actually creating more inflammation in the body because we're unable to digest them because we have poor digestion. So what we need to focus on is how we're digesting and absorbing. Without digesting and absorbing, it doesn't matter what we take. We're not going to heal the lining of the gut. Every cell in our body depends on effective digestion and absorption. So when we don't digest properly, then we increase our exposure to toxins. Remember, they get through that lining that they're not supposed to get through. That causes inflammation, which causes all kinds of imbalances and symptoms and diseases. And if you were to look really closely, you can see just about every disease you can imagine, as Hippocrates taught us, has origins in gut dysfunction, intestinal permeability. So Time magazine told us back in what, 2002 or so, I think, that inflammation is the root of all disease. Well, guess where inflammation starts? It starts in the gut.
Hi, my name is Steve. I'm 62 years old and live in Sandy, Utah. I first started having health issues 2012 when I first noticed my blood pressure was high. It went as high as 220 over 100. At about 2016, I was having problems swallowing my food and dealing with heartburn on a regular basis. May 2019, I visited Dr. Ray Andrew. In July, he started me on the leaky gut protocol. I took my blood pressure and it was very low. I quit taking lisinopril and hydrochlorothiazide. I also quit taking the omeprazole, and so I've not had to take omeprazole since about August 2019. Today is May 14th, 2020. I also went from a weight of 210 to 178 pounds. My health is incredible. Well, maybe that's an overstatement. It's much better than it was a year ago. My pant size went from 38 to 33 waist over a period of 3 months.
So what's really interesting about that, who would have thought somebody with a blood pressure of 220 over 100 could go back to normal? And actually, what he didn't tell you is that his blood pressure got so low that he fainted in the bathtub. And that's why he had to stop taking his blood pressure medicines. And then, of course, he lost weight and he was able to get off his drugs because his heartburn went away, because he solved the underlying problem. So what do we do? How much time do we have, Karen?
Well, we usually go about an hour, and it'll be an hour and about 5 minutes or so.
What?
I know. Dr. Ray, you're always over-prepared.
Okay. Well, so we use a system of digestive enzymes, systemic enzymes, healing herbs, probiotics, vitamin D, bovine colostrum, make sure we're getting enough sleep, manage our stress, avoid toxins, avoid inflammatory and antigenic foods, and eliminate bugs. So this is kind of the big picture of what we do when somebody comes to us with gut problems. That's how we go about fixing them. Here's a list of some of the most common inflammatory and antigenic foods. Note that strawberries are not on this list. And the reason I mention that is because strawberries are not among the most common inflammatory and antigenic foods, but if your food sensitivity test comes up positive for strawberries, then that is antigenic to you. Doesn't mean it's a bad food. It just means that your body cannot handle it right now until we get your leaky gut repaired. Okay, so just talking more a little bit about enzymes, a little bit about probiotics. Probiotics have numerous roles in the body, including improving the diversity of the microflora in the intestines. They educate the immune system. They actually tell the immune system who the good guys are and who the bad guys are. And they make some of our B vitamins and promote healthy elimination, as in a lot of people find that once they take probiotics, their constipation gets better. Vitamin D blocks the damage to the tight junctions in the setting of inflammation. So vitamin D is very important to preventing leaky gut and healing leaky gut. And interestingly, nearly all North Americans are deficient in vitamin D, so it's no surprise that we have an epidemic of leaky gut. In fact, leaky gut probably, I dare say, kills more people than coronavirus. It just doesn't kill them. What's that?
You're so right on that.
It just doesn't kill them in a week or 2 weeks, and so it doesn't get the attention it deserves. A liposomal bovine colostrum. Colostrum is the substance that a lactating mammal produces before milk. It's loaded with nutritional, immune, and growth factors, whereas milk is loaded with water, fat, protein, sugar, and some enzymes, a few vitamins and minerals. We can use colostrum because it has a number of microorganism fighting agents in it, and it is very helpful to healing the intestinal lining. We use a liposomal form because that ensures that it gets down to the small intestines where we want it to be most active. And then we follow a specific list of approved foods. We use a 9-week protocol that includes meal plans and a grocery list, recipes. It tells you when to take the enzyme pills. You have a food journal. We also use an online, actually an app on the patient's phone, so they can keep track of when they've taken their pills, and they can actually, it has a place to journal, so they can report to us without having to call us or email us. They can report right from the app how they are doing and if they're having any problems. This was a study of before the protocol, and you can see 93% of people started out with identifiable digestive disorders. But look at this, 50% of them had chronic pain, 50% of them had headaches, allergies, hormone disruptions, mood disorders, weight problems, all related to leaky gut. Following the protocol, less bloating, better sleep, improved energy. 94% of this patient's symptoms improved, 87%. The least improvement in this one patient was 15%. Of their severe symptoms, we can see that the red is before, green is after. So the severe symptoms had improved dramatically in this group of patients. The moderate symptoms had improved significantly. This is pounds of weight loss in this small group of patients. This one patient actually gained weight, and that was because she was underweight to begin with, rather. Here's the food sensitivity test. We see the food sensitivities drop dramatically from before to after. The moderate reactions also decreased. The stool test abnormalities decreased dramatically. This is just an overview of the improvements. And I wanted to actually draw attention here to the stool. abnormalities. It's really interesting. These red ones are actually things that got worse on the stool test. And what's significant about this is in this study that was performed using this protocol, they did nothing other than the gut repair protocol itself without this was before we added the colostrum. This was without addressing any of the abnormalities on the stool test. So if there was yeast identified on the stool test or H. pylori or some other bacteria that doesn't belong there, they did not address it at all. So these would be a lot better if we did the comprehensive program and retested. But this is just to show what the enzymes and the herbs and probiotics by themselves could do. And they actually improved a lot of the dysbiosis and even yeast. May not have eliminated them, but improved them significantly. So doing the protocol improves our skin, energy, digestion, hormones, your whole life overall, immune system, weight.
I'm Stacy Lewis. I'm 31 years old. Before I came to see Dr. Andrew, I was experiencing quite a few digestive issues and all kinds of food sensitivities. I had nausea and stomach pain often, frequent spells of diarrhea. I've been a lot happier in my gut. Everything settles better. My appetite and my stomach kind of just agree now. They don't argue about whether I'm hungry or full anymore. Food sense better. I don't have bloating and I don't have as much inflammation in my hands. Since being able to introduce foods again, I've been able to have dairy again. And before, I could not tolerate dairy. That caused me all kinds of gas and bloating and irritability and diarrhea. Now I've been able to glass of milk and some cheese with no reaction whatsoever.
You've seen what gut repair can do for others. What could gut repair do for you? Could it make it so you could forget about your gut for a change, stop those headaches, lose some weight, get rid of some rashes, have more energy, have a clearer mind, calm down an autoimmune disease, prevent a disease? You won't know until you do it. Something interesting that I wanted to point out from what she told us was she was able to reintroduce dairy, and the objective of gut repair, unlike a number of things that I was taught in the past, we don't want to avoid foods for the rest of our lives, because a healthy gut actually depends on a good variety of foods. So when we do a food sensitivity test, those sensitivities are not permanent. We want to fix them so that you can go back and enjoy the full variety in the future. And that's all I have to say. Can't hear you.
Sorry about that. I said, awesome. I said, it's the gut is fascinating. It's a whole nother world, isn't it? You know, it really, really is.
It is a big world. And what I've talked about is just a small piece of that big world.
Mm-hmm. Well, we really appreciate all the effort you took, Dr. Andrew, to put together the presentation. We're very grateful for it. And thank you for giving us information on how to contact you if we need you. Does anybody have any questions? I didn't see any questions come in the chat section. So I think you must have taken care of those as you went. And again, thank you, Dr. Andrew, so much for joining us today. Everyone else, we're glad that you're with us on these Wednesdays. Again, anybody who needs to or wants to watch anything else from previous weeks, please go ahead and let us know. And those of you who watched and were part of the Holistic Summit this past weekend, if I work with Shane and Liz, and they would like to know if anybody could leave a short testimony or just email me a couple words or text me, that would be great. I will go ahead and fast forward it to them. They're looking for some testimonials just to put out there on their Facebook page. Don't need to include your name if you need to. Kathleen, go ahead and call Dr. Ray Andrew. He will get you set up. Kathleen's out in Wisconsin, and he'll be able to get you set up with who can be testing out there, and he can send you the test kits. We've done many of those with different doctors globally for Lily, so they make it really easy these days to get tested, even from a doctor. And even if you get the test results you might have from a test you've done in the past, you can call Dr. Andrew and share that with him, and he'd be happy to meet with you for a consultation and review those with you as well. So again, you're in good hands. Okay, everyone, thank you so much for having a great day. I'm gonna go ahead and stop the recording and post it in our area on Human Body Master Guide, and we'll see you again next week. Thank you, Dr. Ray.
Thank you, Karen.